So students, start quickly writing your roll number in the chat box. So that is the evidence that you have joined on a time. I'm expecting now that till now all 104 or 110 students are joining the session. Okay. So I can see some of you already joined. Wonderful. Good number of students have already been joined and they have already posted their roll number in the chat box. I'm waiting from others to quickly post their roll number in the chat box. Very good. So numbers is increasing. Very nice. Someone to remind on WhatsApp group as well. So I think we should start. We'll not waste our time. We should start because in the process of different activities, we need more time to complete today's session. Okay. So let's start with the session. Today we'll study about part 3 of Pharmacology of Alcohol, where we'll study about medical treatment of chronic alcoholism and clinical uses of alcohol. I am Sheikh Abu Sufyan. Welcome you to my YouTube channel Pharma Learning Forever. At the end of this e-learning session, you are able to discuss medical treatment of chronic alcoholism, because in last lecture we have studied about the treatment related to acute alcoholism. Now we'll study and discuss the medical treatment of chronic alcoholism, then explain clinical uses of alcohol, which is one of the most favorite question of the examiner, and lastly discuss symptoms and management of methanol intoxication. So let's start with the first part, that is the medical treatment of the alcohol. So we'll start with the first drug, that is the Naltrexone. So Naltrexone, basically it is opioid antagonist. So we'll be studying different opioid receptor in case of analgesic chapter. But now you just remember that Naltrexone, it is basically opioid antagonist in nature. Now what this drug is doing, the Naltrexone, it provides pleasurable reinforcing effect of the alcohol. Now we have seen that in mechanism of the alcohol it causes the release of the noradrenaline, and the release of noradrenaline, it is responsible for pleasurable effect. Okay, so the pleasure or the euphoria, the feeling of the great happiness which is happening in case of alcoholic patient, it is basically due to release of the noradrenaline. Now if you ask patient to stop the alcohol, now he is not taking the alcohol, or if you are restricted patient by consuming the alcohol, then this noradrenaline will not release and the patient will not get pleasurable effect. Since the patient is not getting pleasurable effect because he has not consumed the alcohol, so as a response to that, that patient will start resuming to the alcohol consumption. So although he had stopped for few weeks or for few days, but since he is not getting that pleasurable effect, he become unhappy, and to get that happiness once again, he will resume alcohol consumption. Now instead of resumption of the alcohol consumption, or instead of that patient can once again go back for consuming the alcohol, that is very bad habit. What you can do, once patient has stopped consuming the alcohol, to get this pleasurable effect, you can give the Naltrexone. So now when you have given the Naltrexone, patient getting pleasurable effect. So when he get pleasurable effect, he will not think of again going back towards the alcohol. So this is how you can stop that patient by consuming or resuming the consumption of the alcohol. Okay, so this is very interesting mechanism by which Naltrexone work. Now let's see exact what happened at the molecular level. At molecular level, its mechanism is it is probably through dopamine mediated reward function. We know that the dopamine, noradrenaline, these are all the neurotransmitter which provide pleasurable effect. Now when you give Naltrexone, what Naltrexone does, it stimulates dopaminergic receptor, and due to stimulation of that, there is release of dopamine, and when dopamine is released, it gives you the pleasurable effect which is similar to the reward function. What do you mean by reward function? For example, if suddenly in some award ceremony, if it is announced that so and so person, it is awarded with so and so award, isn't it? So the moment you hear the declaration of that award, immediately the feeling of feeling which is comes to your mind, okay, that is the feeling of happiness, or sometimes you can see the happiness beyond imagination, isn't it? So that is called as the reward function. So whenever such type of feeling you get, that feeling you are getting because out of excitement there is release of the dopamine from brain, and this release of the dopamine, it mediate the reward function, right? So when alcoholic patients stop alcohol, you can give the naltrexone, it act on dopamine receptor and it provide dopamine mediated reward function. But basic function, it is opioid antagonist in nature, it block opioid receptor. So you must remember this. Now let's move on to and we'll see what are the benefit of the naltrexone. So quickly I will revise. The naltrexone is opioid receptor antagonist. The mechanism, it is by giving dopamine mediated reward function. Let's see the benefit, what benefits it can give to the patient who has stopped consuming the alcohol or who has permanently made mind that I am today onward I am not going to consume the alcohol, right? So these are the benefits. So it prevents alcohol craving. So alcohol craving, it is generally the hunger for alcohol, and it will happen if that patient will not get pleasurable effect, okay? So since he is getting pleasurable effect, the alcohol craving, it is reduced, so he will not again go back to the alcohol. No drinks, number of drinks per day, it is reduced, okay, so or that is prevented. So suppose if someone is taking the more number of drink per day, then this number of drinks can be reduced by giving the naltrexone. Then chance of resume of heavy drinking is also reduced, right? So these are very good advantage, or these are the benefit of giving the naltrexone to the patient who has stopped alcohol consumption or who has made mind to stop consuming the alcohol, okay? It is also approved by the US FDA for the treatment of especially alcohol abstinence, okay? So we have seen the first drug. Quickly I am revising it. It is the opioid receptor antagonist. Mechanism of action is through the dopamine mediated reward function. We have seen the benefit of it, and one more important thing is that it is approved by US FDA, okay? Second drug, it is Acamprosate. It is another interesting drug. Let's quickly see how its work and how it can fulfill or how it can take the place of the alcohol, so that patient should not resume alcohol consumption. So the mechanism, it is through the weak NMDA receptor antagonism with weak GABA A receptor agonistic activity. So it is working in the similar way as alcohol produce action on central nervous system, okay? So we know that alcohol produces CNS depressant by antagonistic action on NMDA receptor. So NMDA basically, it is a excitatory receptor. So it was, I think, one of the muddiest point that I have seen that you have not understood was mechanism of action of the alcohol, right? So so I am going to cover here, you please keep your attention. So NMDA is the excitatory receptor, okay? So the activation of NMDA, it causes the central nervous system excitement. What alcohol does, alcohol produces antagonism of NMDA, and when there is antagonism of NMDA, excitation will reverse and it produces depression of the central nervous system. So alcohol produces CNS depression by producing antagonism of NMDA receptor, because NMDA, it is excitatory receptor, whereas alcohol, it acts on GABA A receptor. So what is the nature of GABA A receptor? GABA A, it is inhibitory receptor, means activation of GABA A, it produces the inhibition of the central nervous system. So GABA A basically, it is inhibitory receptor. So what alcohol is doing? Alcohol produces agonistic action on the GABA A receptor. So it produces more inhibition of the CNS. So CNS inhibition, it is increased, right? So that is the function of the alcohol. Now when you stop giving the alcohol, due to that, now there is no antagonism of NMDA receptor, and also there is no agonistic activity of GABA receptor. So the patient become irritated because his CNS, it is excited. Instead of inhibition, CNS become excited, and as a result of that, that patient become restless and that patient become irritated. So now what you can do, you can give Acamprosate, which can work in the similar way as alcohol. It can produces antagonistic action on the NMDA, and it produces agonistic action on the GABA receptor, and overall result it is inhibition of the central nervous system. Okay, so it is playing the role of the alcohol. Now once patient stop consuming alcohol, you can give the Acamprosate so that there is no withdrawal symptom. So what is the withdrawal symptom? One of the withdrawal symptom, it is the anxiety, irritation. So that can be stopped by giving Acamprosate. Okay, so this is one of the way. It is used in Europe for maintenance therapy of alcohol abstinence. I mean, someone, if he has stopped taking the alcohol, and if you want again he should not resume alcohol consumption, then in that case you can give the Acamprosate. So another important drug, its efficacy is comparable to the Naltrexone. So it depends upon the patient on how that patient responding. You can either give the Naltrexone or you can try with the Acamprosate. Okay. Third interesting treatment, it is aldehyde dehydrogenase inhibitors. So this can be think of in case of patient who has not made his mind to stop the alcohol, or they are resistant to restriction of the alcohol, right? Because alcoholic patients are addicted. So if as a relative, if you ask that patient to stop it, he will not do that, isn't it? So in such resistant patient, you can try with Disulfiram. Very interesting mechanism. Unknowingly, that patient will stop consuming alcohol on himself. आपको रिमाइंडर नहीं देना पड़ेगा, आपको बोलना नहीं पड़ेगा. You just give him Disulfiram. It will produce certain set of reaction where the alcoholic patient start believing that now alcohol it is not suiting to his body, right? So to understand mechanism of action of Disulfiram, first we'll see how ethyl alcohol it is metabolized in the body. Okay, so ethyl alcohol in presence of ADH. ADH, it is not antidiuretic hormone. A stand here for alcohol. Okay, it stands for alcohol. So in presence of the alcohol dehydrogenase, ethyl alcohol it is converted into acetaldehyde, and in presence of aldehyde dehydrogenase it is converted into acetate. Okay, when you give Disulfiram, what it does, it inhibits this aldehyde dehydrogenase enzyme. So you call this category of drug as aldehyde dehydrogenase inhibitor. So when the aldehyde dehydrogenase enzyme it is inhibited, conversion of acetaldehyde into acetate won't happen. So now there is no formation of acetate. As a result of that, the concentration of acetaldehyde it is increased in both the tissue and the blood. So now when there is increase in concentration of the acetaldehyde, because it is not converting it into acetate, there is increase in concentration of acetaldehyde, and it will produces a group of symptoms. So when there is group of symptoms, it is called a syndrome. And since these symptoms or group of symptoms are produced due to acetaldehyde, these group of symptoms are called as aldehyde syndromes. Okay. Now let's see what are the symptoms belong to aldehyde syndrome. So the patient, whenever he consumes the alcohol and if he has taken the Disulfiram, patient will suffer from flushing. His body become red in color and warm. There is thrombing, severe thrombing headache. Okay. Another problem, there is perspiration, there is sweating, feeling of uneasiness, there is tightness in the chest. He may suffer from dizziness. There is sudden dizziness. There is severe vomiting. Sometimes there is visual disturbance in a patient. There is mental confusion. He get confused and his brain become like something like called as the mental clouding, isn't it? So he become confused, and it may also lead to circulatory collapse. So what is happening here? Now you have not asked patient to stop the alcohol, but unknowingly, maybe through food or maybe through water or maybe through juice, you have to ensure that you are giving Disulfiram to that patient. Now whenever that patient he consume alcohol, he will suffer from this group of symptoms. He will suffer from aldehyde syndromes, right? And do you think if patient suffer from this symptom, he will feel comfortable? Obviously he will not feel comfortable, right? It will produce very wild discomfort. And whenever he having the alcohol, he will produce this symptom, he become discomfort, and slowly he start believing that whenever he consume the alcohol, he is suffering from something which is severe, right? And he will slowly stop taking the alcohol. So you have not asked him, but unknowingly you did his treatment so that he can stop consuming the alcohol. Okay. So this is in case of aldehyde syndrome and aldehyde dehydrogenase. Now let's see how disulfiram can be given. So there is standard protocol is there in case of disulfiram. So after abstaining from the alcohol overnight, so suppose yesterday a person has taken alcohol and if he has not taken again in that particular night, so after that you can give the disulfiram probably in the morning, right? So at initially you can give 1 gram as the first dose. So either you can knowingly give or unknowingly give. Better to give unknowingly, right? So 1 gram on the first day, 1.15 gram on the second day, then 0.5 gram. So you can see here the gradually dose of the drug it is reduced. So first you are given a bolus dose and then you are given the maintenance dose. So third day you can give the 0.5 gram of and then last dose you can give the 0.5 gram. So regularly you can keep on decreasing dose of the disulfiram. You are giving this dose for 3 to 4 days. Okay. So now when you give this drug, first day he will suffer from aldehyde syndrome. Second day also he will suffer from aldehyde syndrome, right? So at this moment he will start believing that there is something wrong. Whenever he consumes the alcohol, there is problem. Okay. So he will stop consuming the alcohol, and still if he consumes, then you will give dose on third day also, so that on that day as well he will feel discomfort. Okay. So these syndromes are developed, but after 2 to 3 hours of the first dose. So if you give the 1 gram whenever you are given this, and if he consumed alcohol, then after 2 to 3 hours of that it starts showing the aldehyde syndrome, right? It reaches at the peak at the 12 hours, so it becomes very severe after the 12 hours, okay, to the extent where patient will stop consuming the alcohol. Let's quickly see what are the side effects of disulfiram. Although very interesting treatment, and in difficult patients who are not cooperating or who doesn't make mind to stop the alcohol, you can try out this, but it having certain side effect, like some patient it produces the rashes. So allergic patient to disulfiram, they show the skin rashes. Some patient there is metallic taste, right? So his tongue become metallic in nature, so whatever he eat, he feel metallic taste. Like when you drink the tanker water, you get that taste. So similar line, that patient tongue taste become metallic in nature. He become a nervous. Also there is malaise, fatigue, okay? There is the feeling of discomfort in the muscles. Then also patients suffer from abdominal upset, okay? So these are the problems or these are the side effects of the disulfiram. So although very interesting, but still it cannot be one of the best treatment of alcohol abstinence. So we have seen the 3 type of treatment. So in line with this, I have done with today's part, today's first part. Let's move on to quickly move on to the question and answer session through the chat box. So I am posting the first question and I am expecting that you are quickly giving answer in the chat box. So we have seen some benefit of the naltrexone. I think 2 to 3 benefit we have seen in case of naltrexone. So first question is, it is in line with that, enlist benefit of naltrexone. Yes, I am expecting your answer in the chat box. Let's see who take first proactive initiative and give first answer. Yes. So I'm opening the chat box. My chat box is open. Wish to see quick answer from your side. The benefit of the naltrexone. So I hope you all know that I believe in active learning. I want everyone to participate in the process of learning. So if I see someone is not giving the answer, I don't hesitate to put him in an absent list. Okay, I can see the first answer given by the Sadia. I appreciate his initiative. So it prevent alcohol craving, wonderful. It avoid that. Jihan has mentioned alcohol craving is reduced. Okay, Gulam mentioned about approved by US FDA. That's fine, but it is not that use of the alcohol or the naltrexone. Okay. Alcohol craving is one of the answer. What is the another answer? It is Sufyan has mentioned something like pleasurable effect. Yes, it gives the pleasurable effect. The Maliha mentioned about low heavy drinking. It means it reduces the heavy drinking. That is nice. So it reduces the heavy drinking. It also reduce or it avoid resume heavy drinking. Kais has mentioned that, wonderful Kais. Trupti mentioned that number of drinks reduced per day. Yes, I'm agree. So it reduces number of drink per day, because some patients are the heavy drinker and alcohol become the big problem for such patient. Their family is disturbed, and every part of their life it is disturbed. So that can be reduced by giving naltrexone. Okay, wonderful. So some Priyanka has mentioned about work in brain to treat the dependence on alcohol. Yes, that can is there, because since it provides pleasurable effect, so the patient instead of alcohol, since he get that pleasurable effect from the alcohol, that drug, he will not go back to the alcohol consumption. Wonderful. So I want very quick answer from your side. But it's like the chat box must be flooded with your answer. You are responding very slowly. So I hope you don't have heavy lunch and it has made you lazy. That should not be there. Okay. So Priyanka again mentioned about decreased opioid effect, and basically it is opioid antagonist, and the mechanism also we have seen how what it does. Bushra has mentioned the works in the brain to prevent opioid effect like feeling of well-being. Okay, wonderful. So almost all the benefit we have covered about the naltrexones. Let's move on to our second question. My second question is how Acamprosate work in alcohol abstinence. So here I am expecting the mechanism of action, MOA of Acamprosate. Okay, so I had good amount of discussion on the MOA of Acamprosate. Let's see who give first answer of this question. Mechanism of action of Acamprosate, or how Acamprosate it work. So this is very important drug. Many a time it's come in exam. Write a short note on Acamprosate. Sometimes they ask on the Disulfiram. Sometimes they indirectly ask like write a short note on aldehyde dehydrogenase inhibitor, that is the Disulfiram. Okay, wonderful. So let's see who give the first answer about a mechanism of action of Acamprosate. Yes. I can see the first Sagar has given the answer, that is NMDA receptor antagonist. Very good, Sagar. It is NMDA receptor antagonist, weak NMDA receptor antagonist. Very precise answer by the Kais. Yes, so precise and perfect answer is weak NMDA antagonist receptor. Okay. Then Anjali mentioned about inhibition of the GABA. Yes, so it produces antagonistic effect on the GABA. Very good. So I am so happy that this is an afternoon, that is to around 3 p.m. and you are so active giving the answer. That nice of your class. Wonderful. Okay. Wonderful. So there are two mechanisms: weak NMDA receptor antagonist, and on the GABA A, it produces agonistic action, or it enhances the effect of the GABA. Okay. So very good. So you keep on giving the answer, because my the process of giving the attendance, it is through your activity that you are doing on the YouTube chat box. Okay, wonderful. So let's move on to third question. So the third question, and is the last question of our first part. Give example of aldehyde dehydrogenase inhibitors. So we have seen only one aldehyde dehydrogenase inhibitor. I am expecting the name of that drug in a chat box. It should not take much time. You should be very quick. Don't wait someone to give the answer and then you copy paste and put that in a chat box. So those who give answer at the end, I believe that you are just copy pasting someone answer and putting that in a chat box. Yes. So instead of last respondents, be a first respondent. Okay, so I can see the first answer from Sagar. Very nice, Sagar. Shinde, you have mentioned Disulfiram, Sadia, Mohammad Aftab. So these were the three first people who have quickly responded. Yes, so this is wonderful drug, Disulfiram. So those who have resistant to alcohol abstinence, unknowingly you can avoid them by taking that, by giving or unknowingly giving the Disulfiram. Very nice. So I have done with my first part of the session. You can keep giving the answer. I am moving towards the second part of the session, that is clinical uses of the alcohol. Okay, so second part, it is very important, but I am going little fast. Now you are already charged and activated. So let's see what are the clinical uses of alcohol. So we know that alcohol, it is not used as a drug. Okay, so medicinal use of ethanol are primarily restricted to external application. So better not to consume it. Wherever needed, you can apply it externally. So it is generally limited to the external application of the alcohol as a vehicle for the liquid preparation, rather straightway you are giving as the active drug. Okay. So externally what you are doing, alcohol, it is very good vehicle, because many active drugs which are not soluble in the water, they are soluble in alcohol. So it can be very good vehicle, because many drugs are solubilized in the alcohol. So you can make a tincture, you can add some percentage in the water so that it can get solubilized, and you can consider alcohol as a vehicle to the extent where it does not produce any after effect on the patient. You are not adding like entire one bottle it is of the alcohol, then it is not a medicine. Okay, so you are adding to certain extent so that you will get certain level of the solubility. Important point to remember, it is not given as a drug, it is only restricted to the external application. In no case you are giving alcohol as a drug. Okay, we'll be seeing that their use in case of methanol poisoning, that's fine, but as a treatment of disease you are not giving alcohol, right? So let's see what are the other uses. Other uses are antiseptic. Nowadays we are using hand sanitizer, all those contain the alcohol. It is very good antiseptic. It is a rubefacient and counter irritant, so it is sometimes add in a pain relief spray. If you use the pain relief spray, it contains the drug methyl salicylate and some active drug like diclofenac, and it also contains the alcohol. So alcohol, it provides very good rubefacient and counter irritant effect. Okay. Then rub into the skin to prevent the bed sore. So those patients who are bedridden for more time, you might see that in your family they suffer from bed sore. उनके पीठ में जख्म हो जाती है. Why? Because for long time they are bedridden. Okay. So now what you can do, you can rub alcohol. But you must remember that if already bed sore are there, you should not give. But to avoid bed sore, you can just rub with alcohol so that your skin become tight, because one of the local action we have seen, it is the astringent action, where skin become a tight and precipitation of protein. Okay, and due to its virtue of astringent action, it doesn't allow the loose skin to form a bed sore. Okay, so it can be rubbed into the skin to prevent a bed sore, but caution is that it should not be applied on already formed bed sore, because if the sore it is already formed, then the application of alcohol on the exposed injury, it is very painful. So don't do that. So to avoid it as a preventive measure, you can rub it onto the skin, but on already formed bed sore, you should not apply the alcohol, right? In addition to this, alcoholic sponges you can use to reduce the body temperature in case of fever. So there are, in case of very severe fever, you can use deep alcohol into the sponge, and those sponge you can apply on the head of the patient or on different body part, so that it give cooling effect, right? And you can reduce the body temperature. In addition to that, another interesting use in case of intractable neuralgia, in case of severe or cancer pain, which is if it is not controlled by any of the treatment, or like opioid analgesic and other drug, then you can think of giving the injection of alcohol around the nerve, so that it produces the nerve paralysis, and it reduces the very severe unbearable pain which is related to cancer. Okay, so this is another advantage. You can use to ward off the cold, especially in case of the soldier staying at the Himalaya and other place, they are using the alcohol, they consume it to ward off the cold. In addition to that, it is an appetite stimulant and it is a carminative. So since it stimulates the appetite at the small amount, now you just look at the amount, it is 30 to 50 ml, not like complete one bottle of the alcohol. It is just 30 to 50 ml, or just 10% of alcohol added into some flavor water, can be given as a beverage or the tincture before the meal. So those who having the problem related to hunger, they are not getting hungry, they are not eating good food, in those patients you can give 10% alcohol as a beverage or the tincture before the meal. So it will stimulate the appetite of that patient, and it also improves the digestion in case of those patients. Okay, so this is another use. Reflux stimulation in case of fainting. If someone is fainted, then what you can do, you can just take 1 drop of ethyl alcohol. See, this alcohol I am talking in the first part, it is about ethyl alcohol, okay, not methanol. Methanol, it is highly toxic, do remember that, okay. So reflux stimulation in case of the fainting, so you just one, you can put 1 drop into the nose. Once you added 1 drop into the nose, it produces a reflux stimulation, and the patient can wake up from the fainting, okay. So he can get up immediately. It can be used to treat methanol poisoning also, and we'll see how it's work in case of methanol poisoning when we study the methanol poisoning itself, okay. So this is all about the treatment and clinical uses of ethyl alcohol. So we have seen the chronic treatment, we have seen 3 important drugs, right from the Naltrexone, opioid antagonist, Acamprosate, and Disulfiram we have seen. We have seen the clinical uses of the ethyl alcohol. Now let's move on to another part, that is methyl alcohol. So methyl alcohol, it is very important as far as its toxicity it is concerned, okay. And it is another very favorite question of examiner. Write a short note on the symptom and management of methanol toxicity or methanol poisoning. So let's see that. So let's start with the methyl alcohol. So it is generally added to rectify spirit to render that unfit from drinking. So what happens, since methanol, it is very poisonous in nature, and if you add, if you are adding that into certain ethyl alcohol grade, and if you don't want that this to be drink by someone, then what you can do, you can just add methyl alcohol and mention that in a label. And generally in case of rectify spirit, so rectify spirit is not made for drinking, but suppose if some are alcoholic addict, if they are not getting the alcohol in alcohol shop, then they can drink even rectify spirit as well. So to avoid that, you can add the methanol, put on the label it is dangerous because it is methanol fortified alcohol, and that is the rectify spirit, okay. So once you add the methanol, it render it unfit for the drinking. The people will not drink it, okay. Then mixing with alcoholic beverage, it result in the methanol poisoning. Sometime you might have heard the news in the paper or in the TV that 20-30 people suddenly they die after consuming the alcohol. Why it happen? Because instead of formation of ethyl alcohol, it is quite possible that in the process of fermentation there is formation of methanol, that is methyl alcohol, and we know that methanol, it is very poisonous. So people consume it as ethyl alcohol or the alcohol, but since due to the mistake in the reaction during process of fermentation, instead of ethyl alcohol there is formation of the methanol. And if such alcohol, if it is consumed by the alcoholic patient, that patient will die, right? Because the methanol, it is very poisonous in nature. We will be seeing it, okay. In coming slide we'll see how dangerous it is. So let's see about the metabolism. First try to understand metabolism, and then we'll get idea of why it is dangerous, okay. So methanol, again the enzyme it is same, that is alcohol dehydrogenase, only structure is changed. So in presence of alcohol dehydrogenase, methanol, it is converted into formaldehyde, whereas ethanol was converted into acetaldehyde, okay. So methanol in presence of alcohol dehydrogenase converted into formaldehyde. Then further, this formaldehyde in presence of aldehyde dehydrogenase, it is converted to formic acid. And the main culprit of the toxicity in case of methanol poisoning, it is the formic acid, okay. It is very dangerous. Even if you have touched formic acid somewhere, it will produce a very severe irritation. Now you can imagine if this methanol, when it go into the body, it converts from formaldehyde to formic acid. What happened to the part which is exposed to formic acid? Because it is acid, it is dangerous acid rather, okay. So now this methanol will produces formic acid, and formic acid will produces very severe toxic effect on different part of the body, okay. So toxicity of methanol, it is basically due to formic acid. Another problem with the methanol is that the rate of metabolism of methanol, it is 1/10/7 of that of ethanol, right? Whereas it means the ethanol, it is 7 times quickly metabolized as compared to methanol. And as much time methanol presents in the body, it is going to produce bad effect on the different tissues and organs, okay, because its rate of metabolism, it is 1/7 of the ethanol. So these are the two important challenges that you need to deal with. One, it is the formic acid, And second one, it is the metabolism. So what you can do if you want to avoid methanol toxicity, if someone has consumed it, then you need to correct formic acid production, you need to avoid it, and also you can enhance the rate of metabolism of the methanol so that it can be quickly converted and can be excreted into the urine. Okay, so this is about the metabolism. Let's see pharmacological action. So I am not going into detailed pharmacological action because there is no much difference between methanol and ethanol, only the difference of the dose. So it is a very severe serious depressant. Most of the effects are toxic, and this toxic effect just now we have seen, it is largely due to formic acid. Since its further metabolism it is slow and it is depend upon the folate. It means if you want to convert formic acid into some other thing, then you need to give the folate, right? Because the metabolism it is slow. Otherwise formic acid, by the time it is converted into its metabolite, it will already produce some level of damage to the body. Okay, so the toxic effect is largely due to formic acid, since its further metabolism it is slow, and that is depend upon the folate. Now let's see how what are the other problem. Other problem is the 15 ml can cause the blindness. Look at the dose, just 15 ml, that is the 2 to 3 teaspoon of the methanol is capable of producing the blindness. Okay, so it is so dangerous, right? 30 ml can cause the death. Can you imagine that? Just 30 ml of methanol, it lead to the death. So now, if suppose instead of ethanol, if methanol is formed, and if the entire bottle is drink by that patient, how he is going to survive? There is no question of survival. That patient is going to die, right? So even 30 ml can cause the death in the patient. So it is so severe, it produces so severe toxic effect in the patient. Now let's see what are the manifestation of methanol poisoning. How you will come know patient has consumed the methanol based on their symptoms. So let's see what are the symptoms. So symptoms including vomiting, headache, epigastric pain. Epi means upper part of your GIT. So there are two parts. One it is the lower part and other is upper part. So there is severe pain in epigastric region, that is upper part of the GIT. There is feeling of uneasiness. So these are the initial symptoms. Then patient heartbeat becomes slow and suffer from bradycardia, the condition where the heartbeat or heart rate is slow, it is called bradycardia. So when there is slow heartbeat, obviously cardiac output will reduce and it is going to affect the heart rate, and due to that the patient will suffer from very severe hypotension. So another problem, because maintaining blood pressure in the body, it is the crucial aspect. It also produces the deliriums. It may occur in the patient, and suddenly these patient may also pass into the coma. That is something very dangerous in case of the methanol, that he has consumed it and suddenly he suffer from a state of acute confusion, that is delirium, and then he suddenly pass into the coma. Okay, so these are the different effects. In addition, it produces acidosis, because the metabolite, that is formic acid, it itself is acid, so it decreases the pH, and as a result of that in your biological fluid there is acidosis. It produces the retinal damage. So formic acid, even if you somewhere in the lab, I don't know whether you have experienced that, if the vapors of formic acid, if it exposed to your eye, it produces very severe irritation. Now you imagine if the formic acid itself it is produced in the body, how irritating it is. So it produces the retinal damage. Okay, then this is, as I have mentioned, it is due to formation of the formic acid. Okay, so main problem is the formic acid. Also produces blurring of vision. So obviously irritated eye become blurred and you will not able to see. आपको सब धुंधला धुंधला नजर आएगा. Okay, so blurring of vision, it is another problem. Congestion of the optic disc in the eye, and followed by that the patient become a blind. So we are seeing just 15 ml. After this number of mechanism at molecular level, it make patient blind after consuming just 15 ml of the methanol. Okay, so and if the death is occurred, so generally death is occurred due to respiratory failure, because it produces the depression of respiratory system, and the depression of the respiratory system, it contributes to death of that particular patient. So these are all bad effect or manifestation or clinical symptom of the alcohol. Now quickly see how we can treat this patient. So the first thing that even at low dose, the alcohol produces problem with your eye. So now what you can do, you can protect the eye of that patient with light, because light along with the formic acid, it make the process of blindness become very fast, so that patient become quickly going towards the blindness. Okay, to avoid that, what you can do, if patient someone has consumed methanol, put him into the dark room, don't allow him to exposed to any kind of light. Okay, so protect eye from light. Next thing can be, it is similar to ethanol. You can go for gastric leakage with sodium bicarbonate. Now, can you guess why you are doing with sodium bicarbonate? Because methanol forms formic acid, which may lead to in decrease in pH. It produces acidosis. So, if you are doing gastric leakage, you do with the sodium bicarbonate, so it can maintain the pH in the blood. So that is why you are using sodium bicarbonate. Then combat again, you can able to combat this acidosis by giving IV sodium bicarbonate as well. So you are using two way. One, it is during gastric leakage, and even after that you through intravenous dose. If acidosis is not corrected, you can give a certain amount of IV bicarbonate, so that pH can be maintained. Okay, blood pH can be maintained. So to combat acidosis, you are giving IV bicarbonate. In addition to this, methanol, it produces very severe deficiency of potassium, that is called as hypokalemia. Now, in case of hypokalemia, you can give potassium chloride infusion. So slowly you can give through the infusion, so that there is no hypokalemia. So sometimes you ask that patient to quickly undergo some diagnostic test, or once it's coming to the hospital, immediately you are starting diagnostic test. So wherever problem is seen, you are correcting it. Like suppose you found it acidosis, you are giving sodium bicarbonate. If you found that there is deficiency of potassium, so you can give potassium chloride infusion to the extent where the potassium level can be normal, because potassium, it is very crucial in cardiovascular functioning. Okay, so potassium chloride infusion can be given. In addition to that, you can think of giving ethanol. We have seen one of the use of ethanol, it is in case of methanol poisoning. So when you give the ethanol, what ethanol will do? Ethanol will saturate alcohol dehydrogenase enzyme. And we have seen in case of metabolism of methanol, methanol in presence of alcohol dehydrogenase enzyme, it is converted it into a formaldehyde, and further it is converted into formic acid. Now when you give the ethanol, all dehydrogenase enzyme will be occupied by the ethanol. So now this enzyme, it is not available for conversion of methanol into its toxic metabolite, that is formic acid. So now if formic acid doesn't form, you are successful in stopping the toxic effect of the methanol. So this is how just you have given the ethanol, so that the alcohol dehydrogenase enzyme can be saturated and it retard methanol metabolism. Okay. Other treatment option could be hemodialysis, which is quite common. We have seen it in ethanol poisoning also. Then interesting drug you are giving it is the fomepizole. I am not going into detail of this drug, but just remember that it is specific inhibitor of alcohol dehydrogenase. So it inhibits alcohol dehydrogenase enzyme, so that there is no conversion of methanol into formaldehyde and into formic acid. Okay, so you have stopped that enzyme there and there, so that it doesn't produce toxic metabolite. Because in case of methanol poisoning, problem is not methanol, problem is their methanol, it is the metabolite of the methanol, that is formic acid. So you cannot allow conversion of methanol into formic acid, so that all the alcohol it is remains in the body can be removed by the process of hemodialysis. Okay, so that could be one of the treatment. Then you can give a loading dose of 15 milligram per kg IV in case of famotidine, and then 10 milligram per kg you can give every 12 hours till the time that patient get recover. So this, the 10 milligram per kg you are repeating till the time you see that there is no sign and symptom of methanol poisoning. In addition to that, we are giving folate therapy. Why we are giving folate therapy? Because we have seen the metabolism of methanol, it is folate dependent. Its metabolism of formic acid, it is folate dependent. Now if you give the folate therapy in the form of calcium leucovorin 15 milligram, that is one of the form of folate that can be injected for every 6 hours. If you are doing that, although formic acid it is formed in the body, it is converted it into non-toxic metabolites. Okay, because formic acid metabolism, it is folate dependent. Okay, so since you give the folate externally, Now it will start quickly metabolizing into non-toxic metabolites. So that is the advantage of giving folate therapy. So I have done with my today's session. I have referred KD Tripathi, Essential of Medical Pharmacology, 6th edition.